Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Diuretics, we're looking at the excretion of the electrolytes. So the first one will be, we are looking at the CAI. So CAI stands for the carbonic anhydrase inhibitors. So we'll be looking at the three segments. That is, firstly, we'll be looking at sodium, then the potassium as well as the calcium. So sodium, potassium, calcium. So in terms of the calcium anhydrase inhibitors, so here the sodium will increase and the potassium will also increase, and there is no change in the calcium. Then when you look at the OD, that is the osmotic diuretics, there is a similar pattern. That is, there is a higher increase of sodium, there is an increase in potassium as well as. To watch the full video, please click on the link below and it will redirect you to the main video.